Welcome to the poster, Interprofessional Education Innovations in the Academic Setting. Authors of this poster are myself, Pam Pellegrudo, Melissa Miner, Valerie Vanderhoff, and Joanne Jankowski. The United States healthcare delivery system and its stakeholders, including academia, are seeking to improve healthcare outcomes. Collaborative teams are needed to address the complex needs of patients with multiple diagnoses or chronic diseases. To prepare students to effectively work in a collaborative model, implementation of an interprofessional education among healthcare students of different programs is an essential component of any allied health curriculum. The purpose of this study was to implement an interprofessional education simulation that required collaboration among 28 students from the physical therapist assistant, nursing, and human development and family studies programs at the Penn State Fayette, the Eberly campus during fall 2021. Our goal was to determine the effectiveness of the interprofessional education simulation in increasing students' self-rated interprofessional communication ability. A convenient sample of 6 physical therapist assistant, 12 nursing, and 10 human development and family studies students participated in a simulation involving providing discipline-specific interventions to a standardized patient. All students were provided with a scenario of a complex patient that involved the need for all 3 disciplines. Each student had the opportunity to review the case, followed by providing discipline-specific care to the standardized patient. The standardized patient was trained to role-play the patient in the scenario and provided the same experience to each student. After engaging with the standardized patient, the student's IPE team that consisted of 1 to 2 students from each profession participated in an interprofessional team meeting to discuss the patient. During this meeting, students discussed how each profession could be involved in patient care to achieve the patient's outcome of returning home safely. The final stage of the research was a simulation debriefing led by a facilitator where participants engaged in reflective thinking regarding the simulation. The Interprofessional Education Collaborative Competency Self-Assessment Tool was administered pre and post simulation and used to assess students' interprofessional interaction through individual student self-assessment. Students were asked to rate their ability on each competency item by selecting their level of agreement on a 5-point Likert scale. Descriptive statistics were tabulated for the sample as a whole and by discipline. Pre and post mean scores among the 28 students showed a statistically significant improvement in self-rated overall communication interaction ability following the IPE activity. Additionally, pre and post scores differences showed the greatest change in nursing students with the least change in human development family studies students. The students from each program were at different stages of their curriculum. The timing of the IPE in the student's curriculum may have contributed to the different scores among the 3 disciplines. The analysis of changes in scores indicated that the objective to improve interprofessional communication with implementation of an interprofessional simulation was achieved. This research indicates it is important to improve interprofessional education into allied health curriculum and ideally creating a safe environment for students to role-play team dynamics. There exists a gap between the healthcare profession's education and the healthcare delivery system. Students' preparation for career entry should include participating with other professionals in a team that ultimately will provide improve the quality of healthcare services. This study has the potential to positively impact our education institutions and students with regard to breaking down silos between disciplines by starting in the allied health curriculum. Combining IPE and simulation provides the students opportunity to interact with each other while caring for patients in a collaborative, safe learning environment. Thank you for attending this poster presentation.